introducing ourselves. Good morning, sir. I am Francesca Duyag from Our Lady of Fatima University. Back massage. Back massage provides comfort and relaxes the client by paying special attention to pressure points. Before we start the procedure, we will approach the client safely we will identify the client by asking his or her name and birthday. May I know your name and birthday? After that, we will explain the procedure. I will be performing back massage to improve circulation to the back, to refresh the mood and feeling, to relieve from fatigue, pain, and stress, to induce sleep, to prevent bed sore, to provide comfort. Then provide the privacy of the patient by closing the door or the curtain, and adjust the room temperature for comfort. We ask for oral consent. Okay, sir, I will now start the back massage. May I have the permission to touch you, especially your back? Okay, sir, can you now lay down on your stomach? Assuming we did general assessment of the client, we will only expose from shoulder to sacral area. Other areas should be covered with top sheet. Perform hand hygiene. Assuming that I applied oil on the client. This massage technique is effleurage or stroking. This is stroking the back with finger by long, smooth stroke upward to downward. Effleurage is a type of massage consisting of long, slow gliding stroke. The second massage technique is friction. These movements are in circular nature. It is performed with the help of the thumb and finger pads. It also helps in reducing swelling after nerve inflammation. The third massage technique is tapotement. This involves hacking, tapping, beating, clapping. Tapotement helps in atrophied condition of the muscle. It increases the blood supply and strengthens muscles. And last but not the least, massage technique. Kneading. Kneading is a part of the Swedish massage tradition and involves the grasping and lifting of tissue. It is usually performed with the palms, first pressing down on the muscular tissue. After the procedure is done, we will remove extra oil that is used on the client. We will help the client put on the clothes again and provide a comfortable position after giving back care or back massage. We will do evaluation of patient satisfaction. Okay po, sir, may I ask if satisfied po kayo sa back massage? After that, terminate all used materials, and hand hygiene, then document po tayo.
First step that I will do is check the patient chart and verify the doctor's order. Hello ma'am, I'm Charmy Valerio, your student nurse for today. Can I ask what's your name po? How old are you na po? And when is your birthday? After that, I will perform a hand hygiene to prevent the transfer of microorganisms. Ma'am, pwede po ba kayong hawakan? I'll assess the patient's muscle strength and ability to follow instructions to ensure safe transfer. We'll be using or assuming this chair as a wheelchair to the transfer. Place one arm under the patient's leg and other behind their back. Support the patients as they dangle their legs. We'll sit here for a couple of minutes to make sure that the patient is not dizzy. We're gonna use a transfer belt to provide a safe hold for transferring. I'm ready to lift you up on a count of 1 to 3. Instruct the patients to nurse arm rest. Ask the patient if she is comfortable. Check the alignment of the wheelchair. I'll be performing a hand hygiene. Last step is document the findings.
First, assess the amount of assistance required for the transfer. In this scenario, 3 nurses are needed. Then, identify and inform the client about the transfer. We will do hand hygiene. Hi ma'am, may I know your name po? Your birth date? Okay po, your doctors order you to have a CT scan today. Then, assist the patient to raise her head to remove the pillow. Then, cross the patient's arm over her chest and help her cross her ankle. Ma'am, on the count of 3 po, we will turn you into the side. 1, 2, 3. Then, put the slide board. Let's assume this is a slide board. After that, gently roll the patient back into the slide board. Adjust her position to center her weight on the board. Then, we will pull the slide board with the patient into the stretcher. Position the patient in the center of the stretcher. Then, place the pillow and blanket. After that, assess the body alignment and raise the side rails. Then, do hand hygiene.
Good morning, sir. I am Joanna Garcia from Our Lady of Fatima University, and I will be assisting you for today. Can I please know your name po? Birthday? Age? Okay po, thank you so much. Now, I will be assisting you for your oral health hygiene to ensure that your teeth are healthy, as well as to remove dental plaque. For this procedure, we will be needing a toothbrush, toothpaste, and a cup of water. To begin the procedure, I will perform hand washing technique and wear gloves for safety. Okay, sir, start na po tayo. So, first po, I will put a pea-sized amount of toothpaste on the toothbrush and then place it po 45-degree angle to your gums and brush ko lang po gently in a circular motion. Next naman po are the outer and inner chewing surface of your tooth. Next po, I'll be brushing your tongue and then lastly po, the roof of your mouth. You can rinse and gargle na po. Okay, sir, done na po tayo with the procedure. I'll just wipe your mouth po and perform hand washing techniques. And last po is to document the procedure.
So before I proceed with the shampooing, I will check the chart and nursing care plan for any information, orders, and limitation. I will now introduce myself, verify the client, explain and assess the client condition. Good morning po. I am Joey May from Our Lady of Fatima, your student nurse for today. For verification lang po, may I know your name? Your birth date po? Okay. So, for today po, isi-shampoo ko po kayo para po maalis yung dumi sa buhok natin as well as sa scalp po. Okay lang po ba? I will now assemble the equipment. After that, I will move the patient near the side of the bed. After positioning the patient, I will position the bath blanket and fan folds the top sheet to the foot part. Then, I will cover the floor with newspaper and place a pail over it. I will now place a bath towel around the patient's shoulders and neck. I will now remove the pillow and cover the pillow with a waterproof pad and a towel. After covering the pillow, I will place the pillow under the patient's head so when the patient lies, the head is tilted backward. Now, I will arrange a through under the patient's head with one end extending to the pail. Now, I will plug ears with cotton balls and then cover the eyes with folded washcloth. I will now check the temperature of the water. The water should not be hot and not too cold. It should be in an appropriate temperature. I will now wet the hair and taking care to keep the water out of the patient's eye. I will now apply shampoo using both hands. I will massage the scalp using fingertips and avoiding using fingernails. I will now rinse the shampoo by pouring water over the hair. Repeat the washing and the rinsing 2 to 3 as necessary. I will now dry the patient's forehead and ears, and then I will remove the cotton from the ears and raise the patient's head and wrap it in a bath towel. I will rub the patient's head with a towel to dry it as much as possible. I will now comb and arrange the patient's hair. I will just leave a towel under the patient's head. After that, I will remove the throw and adjust the pillow. Now, I will remove the bath blanket. At the same time, I will bring up the top sheet. Change the patient's gown if necessary. And then, lower the bed and raise the side rails. I will now position the patient in a comfortable position. After the shampooing, I will return equipments to be clean. I will now wash my hands and document observation.
Good morning, sir. I'm Shane Nicole Lictao, your student nurse for today. For some verification, may I know your name po, your birthday, and your age po? Assuming that I already checked the doctor's order, perform a hand hygiene. Make a bath mitt with a washcloth. After doing a mitt, I will proceed now to the face. Wet and apply soap to forehead, face, over and behind, ear, and neck, and then clean eyes from inner to outer canthus. Sponge, towel, and allow patient to wipe face. Then dry with face towel, replace at head end of bed. After doing the face, let's proceed to the arms and hands. Massage the pressure areas. Place the hand in a basin of water to wash. Rinse and dry while paying attention to the skin under the breast. Recover with towel. Assuming that I already done with the other hand and arms. So assuming that I already washed the chest and the abdomen. Now let's proceed to the legs and feet of the patient. Uncover the farthest leg and place towel under the leg. Massage the pressure points. Assuming that I wash the back and the perineum pubic area of the patient. After the procedure, help the patient to wear a lab gown. After all of the procedure, do the hand hygiene and document the procedure.